They're obviously way below their normal body weight. They're very controlled, very rigid, very set in their ways, and it's really a no-brainer to start from there. It's a little bit different with someone with bulimia because they tend to be very shamed about their behaviors. So it's not something they'll walk into the office and say, by the way, Dr. Berkus, I'm purging. So it usually will start with, I'm depressed, or I'm not sleeping, or I can't get my thoughts together. And as I take a history and we start talking, it comes out about the fact that they have been purging and they're not meeting their goals of life, whether they're a student, whether they're beginning to start a certain phase of their life as a newly married person or as a new job, and they're not making their goals in terms of meeting the needs. Compulsive overeating, there usually is obviously weight gain, and the person has been yo-yoing and has successfully lost weight. Most people who are compulsive overeaters and fighting their weight can lose weight. And they've come to me after losing 100 pounds on Weight Watchers or Jenny Craig or their own diet or whatever program they've tried. They can lose it. They just can't keep the weight off. And then it usually becomes a point where it's causing difficulties, whether it's medical problems or problems in a relationship. That's when they seek medical help. I usually tell parents that it takes a team. I wouldn't go up against treating an eating disorder in a patient by myself. It requires a team of a nutritionist, a therapist, a physician, and a psychiatrist. And that's because this is such an ongoing, pervasive, unrelenting disease process. So I will tell a parent their job is to be parents. They can't be a co-professional because they're not trained. And that's where we come in.